All right, you guys, good morning. Hello. This is going to be our, excuse me, final lecture for, wow, the skeletal system. Okay, so we're going to go through the bone and joint disorders that we need to know for our test. There's 8 of them. All right. The first one is the cleft lip or cleft palate. So hopefully you remember in your face you have your maxilla, your maxillary bone, which is going to be where your top teeth are, okay? And in the development process, when you are first forming, you can see here that I'm circling in yellow. This is like about 6 weeks of development. And if you look right here, it says the maxillary process, and it's pointing to this bone right here. Okay, well, that I just made yellow is going to be this right here. All right, now obviously you're not going to have teeth in there at this point because your teeth haven't formed, but this is the development start of the bone. Remember, the bone is going to start with the cartilage cells. The cartilage cells are going to have the bone cells be introduced, right? Those osteoblasts are going to work to calcify the bone, making the maxilla. So if we look at the maxilla here, you can notice that right down the middle, there is a split. And that split is because these two bones need to join, they grow together, okay? And they grow together, creating the roof of your mouth, okay? So here is again, the roof of the mouth. And I just showed you that it is 2 pieces. And if those 2 pieces don't come together and grow together like they're supposed to, you end up with a hole in the roof of the mouth. Okay, so this goes then straight up into the sinuses. Notice here's the maxillary sinus. All right, so those are going to go straight up into the sinus. Now, the difference between a cleft palate and a cleft lip, there's a difference, cleft lip and a cleft palate. If it comes through the front of the face, it's going to be known as a cleft lip. If it's just in the roof of the mouth, it's known as a cleft palate. But either way, doesn't matter what it is, which it is, they still are going to do surgery to close it up. A lot of people don't recognize what that scar on somebody's face might mean. And sometimes the scar is so slight, you don't even notice it. All right. So there are doctors around the world that will go and perform this surgery. It is considered to be, I don't want to say it's a simple surgery because of the fact that, well, it's to do with your face and all of that. And it's very complicated and complex, but doctors are very good at doing it. I want to say that there is a nonprofit organization that goes around the world and deals with cleft palates because in other countries they will not fix them, whereas in this country, if your baby is born with a cleft palate, the doctors will help you get it fixed before the baby's developing. I actually don't know exactly when in the process that you would have it fixed, but I know that this young lady here on the screen has had hers fixed. They usually are fixed when they're babies, okay? And then as people get older, you barely even notice them because the scars are so small. They do a great job. Okay, scoliosis is the second disorder you guys should know about, and scoliosis is due to a lateral curvature of the spine. So remember what lateral means, to the side. And your spine is supposed to have curvature, but it's supposed to have a cervical curvature and a lumbar curvature, a thoracic curvature, and those go front to back, right? Anterior to posterior, whereas this is a lateral curvature. And it causes problems with the squishing of your organs. It causes a problem in walking. Again, in our country, we do our best to try to fix this. In other countries, they don't get the medical care. So we often see people like the one on the far right there in other countries, third world countries, where they don't get the medical treatment. but it is uncommon to see scoliosis like this in America. We definitely have scoliosis. We check for it, I want to say, in 8th grade, usually during PE class. At one point, a female with the females and a male with the male, usually for the PE teachers, whatever, and the school nurse, they will have you lift up the back of your shirt and the nurse will look for your straight spine. And we do find lots of cases where kids have problems with scoliosis as they develop. And again, we try to catch it in middle school. And when you are diagnosed with scoliosis, you then are sent to a bone specialist that can help treat your scoliosis. Okay, this right here is the picture of a joint. So a knee joint is a common one where you get damaged cartilage. So this is arthroscopic examination of a joint that has torn cartilage. And hopefully at this point you understand that articular cartilage should be smooth and free of any sort of defects or rubbing or anything like that. And all of these little particulate pieces that you see here moving around can definitely cause pain in the joint. Okay, so the two bones were smashed together at a point where they ripped the cartilage, and doctors can go in arthroscopically. So they cut 3 little holes, or sometimes it's 4, I don't know, it depends on the doctor, the procedure. And they put in a light, a camera, and then the device. The device they use to clean this up is a little bit like a straw. And right at the end of the straw, there's a razor, and it turns. And so anything that goes inside the straw gets cut off. So if you're in the joint, you think about it, the articular cartilage is supposed to be completely smooth. So the doctor can go around and move this little thing around, and whatever gets sucked in will get cut off. And so all of this stuff that you see here that's like feather-like, or that's, right, all of these little parts right here and all of this little part right here, right? The doctor can then just take his tool and, here, let's do this. Using his tool, he can just simply shave off all of this and make it all smooth again, and shave this off here and make it all smooth again. So all of this right here that you see, like all these little hairs that are flying around, whatever, those is what the doctor would cut off during a cartilage repair surgery. Okay, awesome. There is no way to repair the cartilage. The first person that comes up with an artificial cartilage that we can glue to our bones will be a bazillionaire, because everybody has cartilage damage over time. And when you get old, you get osteoarthritis, which osteoarthritis is going to be a decomposition of the cartilage on the joint. And so therefore the joint doesn't slide past itself like it's supposed to. There is friction. It causes further deterioration or erosion. And osteoarthritis is something that you get with age. Some people have osteoarthritis and are in pain. I am lucky enough that my osteoarthritis does not cause me any pain. But again, it's going to be a wearing away of the cartilage. Okay, so here's a picture of the joint. I want you to remember where that articular cartilage is and where that synovial membrane is. And of course, look, there's the joint capsule. The joint capsule is going to enclose all of this. And if you have the other type of arthritis, rheumatoid arthritis, you're going to have a swelling of this whole joint complex. So the synovial membrane gets distorted, the articular cartilage ends up distorted, all right? So the synovial membrane is going to swell, and as that synovial membrane swells, look where the synovial membrane is. The synovial membrane is on the inside here. I'm going to go back to my yellow. My yellow is pretty predominant there. Okay, so it's inside the joint there. I'm going to erase it so that way you can see it now. It's like a light reddish color, okay? That gets swollen, it's inflamed. And as it gets inflamed, it causes the joint to deform. All right. And it is an autoimmune disease, which means your immune system starts fighting something that's not there, or something that your body shouldn't be fighting. And so with the swelling, your joints become very painful. Imagine every joint in your body being painful to move because it's swollen. It's a very, very painful thing. Osteoarthritis is something that you can control with medication. So if somebody is diagnosed with rheumatoid arthritis at an earlier age, the medications that they prescribe these days are much better at helping people live longer, healthier lives without this sort of damage. Okay. All right, E on your list is dislocation. This right here is a shoulder joint that you can see, and this basketball player is out. The glenoid is going to be the cup that holds the ball in the ball and socket. And so the humeral head that's there says that this bone, the humerus, has come forward and is in front of the glenoid, in front of the collarbone, where it should be back. So the doctor will take it and actually try to put it back into place. So they have to take it and pop it back into place. I was recently watching an episode of Survivor, and sure enough, the young lady in one of her competitions had her shoulder dislocated, and they had a medical person on site that did this to her shoulder. And as soon as her shoulder was back in place, she was like, okay, I'm good. But before that, very, very, very painful thing, okay? And then here we can see a dislocated finger. A dislocated finger, again, can be very painful. You can see in the x-ray right here how the bones are out of alignment. And that, again, is going to be distorted at the surface. You'll be able to see it pretty clearly. The doctors then will take it and they will manipulate it to pop that bone back into place. All right, so that is going to be how we treat dislocations. When that happens, you can end up with strained and sprained ligaments. All right, so that's a secondary problem that can happen with dislocating something, is the ligaments that hold everything in place can become strained. All right, okay, so vitamin D deficiency, also known as rickets, is another thing that can happen with the skeletal system. If you don't have vitamin D, your body cannot calcify the bone, okay? So what ends up happening is your bones are soft and they round out with pressure. So this young lady right here definitely has a problem with rickets. She's not getting vitamin D. The vitamin D that we need, we get in our diet. We found that many people were vitamin D deficient for some time, and we started adding it to orange juice and milk. So now most of the products that we buy are fortified with the vitamins that we have been lacking. Okay, remember vitamin D is something that your skin helps make with the sunlight. But you also take it in your milk and so forth. I know my doctor recommended, I started taking vitamin D a number of years ago. They tested my levels and found that I was very low. And even though I spent a considerable amount of time in the sun, so it just depends. This young lady will heal normally as she gets the vitamin D she needs. Her body will start to make those bones stronger with the osteoblasts and osteoclasts being able to calcify those minerals, make that bone stronger. Okay, so all she needs is that vitamin D and she'll be back on her way, which is great. Okay, osteoporosis. If you have pores in your osteo, that's bad, okay? So your bones are supposed to be nice and dense. We're not supposed to see holes in them. So you can see in the picture here that there's holes in these trabecula. That is bad, and it makes the bones very, very soft. or very breakable. I shouldn't say soft, because soft is like a pillow is soft. No, they're just very fragile. So they're easily fractured. Okay, so they're not soft, they are fragile. And when old people get osteoporosis, they break bones very easily, or their vertebrae get crushed. All right, so it is really important that we keep bone health in mind as we get older. One thing that you can do to keep your bones healthy is always put demand on your skeleton. And what do I mean by that? I mean working out, weightlifting. You know, if you're an old lady, which, an old man, whatever, if you're an old person, even just unloading and loading your own groceries, you know, walking to the store to buy whatever it is that you're buying, being active in your old age is what keeps you young, all right? So you may want to put that into your lifestyle, that, you know, your life is a workout. That's the way I think of my life. I do a lot of stuff around my house myself. When winter time comes, sometimes I get a load of firewood and I like to move it all myself because it's my workout. And as my body gets older, as long as I keep demanding that it stay strong, it will. But if my body gets to the point where all I need to do is pick up my phone and my purse and that's it, well, then my bones say, oh, I don't need to be strong anymore. I only need to pick up something that's very light and I don't need that strength. And so then, of course, in your daily life, you're moving around, you bump something, you break a bone. Okay, osteoporosis is something that you don't want, so you want to make sure to eat a good diet, get lots of calcium. And where is a good place to get calcium? Lots of people think that dairy products are the best place to get calcium, and they are not. The best place to get calcium is in green leafy vegetables and broccoli, all right? So if you look this up on the internet, you're going to find that milk has far more calcium than broccoli, but you have to understand the physiology of the body. The body is not going to be able to process the calcium that comes in dairy products. But the calcium that comes from the greens is in a different form. And your body is able to absorb the milligrams of calcium from broccoli and green leafy vegetables at a far greater rate than that of the dairy products. So your body can absorb more calcium when you eat green leafy vegetables and broccoli. Okay, there's some other stuff as well, but the point is that it's not dairy products that are the best source, just so you know. All right, and then the last thing that we're going to talk about is torn ligaments. Oh, I didn't show you the pictures. I'm sorry. During osteoporosis, there you can see if somebody fell, you could have a broken femur. If the head comes off your femur, that requires surgery. That right there is a very, very tough thing for an old person to recover from. The other thing is that sometimes as we get older, we get lazy and we don't stand up straight, we don't sit up straight, and our vertebrae can become not as strong to hold our head up, and then your bones get used to that position and then you can no longer stand up straight. So it's important to stand up straight. It's important to get a proper diet to make sure you don't get osteoporosis. Okay, and then the last thing we're going to talk about are torn ligaments. If you strain or sprain a ligament or your ankle, or a ligament in your ankle, you will feel it, right? There's no bone that's broken, but the ligaments, of course, are holding bone to bone. So if you look at the picture there, you can see that, the tibia, which is this bone here, okay? The tibia is connected to this bone in your foot right here with this ligament. And if you notice, under where I colored, you can see it's torn. All right, so this is a torn ligament. You do have ligaments in your knee. There are some common ligament injuries, which way back up here, we should have taken a look at the knee. All right. So here in the white, we see lots of ligaments. Here is your ACL, which some of you that play sports or run or those sorts of things know about. And these are all going to hold all of your bones together. It's very, very interesting how all of this is held together by those ligaments. And then you have your meniscus. Your meniscus is a piece of cartilage that sits in there in order to protect and act as a bumper in your knee. Okay, so you have an extra layer of padding in there. All right, and if you tear any of those or if you strain any of those, then you need to treat it with rice. And I love that people always ask me about the rice thing, because how does rice treat your damaged ligaments? Well, it's not rice. The R stands for rest. You do need to rest it. Okay, when you keep using it, it will not heal. Ice. You want to ice it to produce a relieving. You want to relieve the pain as well as the swelling. When things are swollen, the body's immune response is there trying to fix it, but too much swelling actually slows the process. So we want to put ice on our strains and sprains, okay? And you're gonna do it multiple times. It's like a treatment. You ice it, and you can ice it, following doctor's orders, but 2 or 3 times a day. All right, compression, you wear a compression sock. If it's on your foot, maybe you wrap your knee, right, an ACE bandage. So if you put some compression on there, that is going to help it, keep everything nice and tight, keep the swelling down, all right? And then last but not least, elevation. When you have any sort of damage to your body, if you can elevate your damage, it will be less painful, and again, it will help reduce the swelling. Your body produces swelling because of the immune response, but again, too much is not a good thing. Your body kind of overdoes it from what we understand about the healing process these days. So torn ligaments, again, are treated with rest, ice, compression, and elevation, abbreviated to RICE. You'll hear that from sports people sometimes. Oh, rice it. Okay, so now we have gone over the disorders and the dysfunctions of the skeletal system. This is not a comprehensive list. There is a number of other things that I wanted to include that are very interesting. Multiple myeloma is a type of cancer that can form in the bone marrow, as well as leukemia is a type of cancer that can form in the bone marrow. That's definitely a bone disorder. There's other things. There's something also called Marfan syndrome. Marfan syndrome causes the bones to grow more than they proportionately should, making the person very, very tall and slender. They believe that Abraham Lincoln had Marfan's. So when you think about what Abraham Lincoln looked like, if you knew what he looked like, again, it creates a very tall, thin person. And there's a bunch of other bone disorders, but anyway, that does it for our skeletal system. I would like to remind you that you need to finish your notebook with a summary, and I am going to go over how to write a summary. So look for that. All right, have a good one.